Welcome to the post-scanning review video for the single crown. Once the scanner finishes post-processing, it displays the occlusal view of the model. The occlusal clearance color map appears to help the doctor access occlusal reduction. The occlusal clearance will show the model from the occlusal if the preparations are in one arch. If both arches have preparations, the display will be from the buccal. When you want to adjust the occlusal clearance of the prepared tooth, tap on the tooth highlighted in blue to see it displayed. Be sure to rotate the tooth to the buccal view before using the eraser tool. Select the occlusal clearance icon to visualize the area to be modified. Then, select the eraser tool. Draw a large circle on the model of the area to be modified. After erasing the desired area, tap the sleeve icon to rescan. Make sure to select the sleeve icon that is part of the eraser tool and not the sleeve icon at the top of the screen. Next, tap the View Mode icon to see the modified model. Rotate the model to assess the margin line from the inside. This is called the negative view. Looking at the negative view of the virtual model is equivalent to reading a conventional impression. Toggle on the upper arch to assess the bite registration and occlusal marks. If the patient closed with enough pressure as described in the bite registration chapter, you will notice the areas where both virtual models are in contact. Look at the area highlighted on the screen to see that there is a contact point at the cuspid. Reviewing the prepped segment to ensure the complete capture of the mesial and distal surfaces of the adjacent teeth is critical to creating a properly fitting crown and reducing the need for adjustments. Currently, you see the model rotating to assess if the contact points are solid and if there are no voids in that area. Review the preparation in color. Let's check that the margin line is clear and that there is no debris and moisture contamination, such as blood and saliva on it. Turn the model 360 degrees to review the margin line from each aspect of the tooth. Toggle the model to monochrome and review it from both perspectives, positive and negative views. Note the mechanical separation between the gingiva and the margin line. If you can assess the margin line with ease, your lab technician will also be able to do so. There are small areas where the gingiva is not detached from the tooth. For such scenarios, the negative view is the perfect way to assess the margin contour. Toggle the preparation segment, lower left quadrant, to analyze the contact points. Note that some voids are present, but they are away from the contact point area. If a specific preparation surface is cut short or expands into neighboring teeth, the preparation separation tool can be used to ensure that the preparation is isolated properly. The preparation area should be highlighted in dark yellow when the tool is activated. This tool has addition and subtraction modes to isolate the preparation from the rest of the arch scan. Tap the envelope icon to send the case to the next stage. From here, you can go back and rewatch any topic in the menu. Remember, you can access the case via the iTero.com portal on your computer and proceed with the notes from there. It starts with iTero.